Hello everyone, good evening. I'm Dr. Vishnu Vasudevan. I'm a consultant endocrinologist practicing in Kerala. So this is a Facebook live event which is organized by the Endocrine Society of India. Endocrine Society of India, or ESI, is the largest professional body of qualified endocrinologists in India. It is part of the ongoing FB live series which is happening every Saturday evening, that we are trying to create awareness among the public about common endocrine disorders. As you might be aware, endocrinology is the study of hormones. Hormones are messenger molecules which travel from the circulating organ or endocrine gland, which is called endocrine gland, and travels to the destination in all of our body and affecting all of our body functions. We know that common endocrine organs are thyroid, adrenal, pituitary, etc. Pancreatic beta cells are also one of the most important endocrine organs. So pancreatic beta cells being an endocrine organ, diabetes is the disease of pancreatic beta cells. So diabetes is an endocrine disease, and endocrinology is the super specialty which deals with most number of cases of diabetes and most types of diabetes cases. So we know that there is so much of information available nowadays through our smartphones, through our laptops, in social media. We are bombarded with many facts, but many of those facts may not be facts. They might be myths, and they are becoming so rampant nowadays, some of which have become even urban legends. But we know that whatever be the source of the information, a false information is a false information. A myth is a myth. And as a super specialist of diabetes endocrinology, we are having the authority, and we do have an obligation to the general public to bust many of these myths and to try to impart some scientific knowledge into common people and fellow practitioners. So today, for that, we have 4 eminent endocrinologists from all over the country. We are joining today in this Facebook Live to discuss the most important aspect of diabetes, that is regarding myths and facts. So the first panelist of today is Dr. Sri Krishna Acharya. So Dr. Sri Krishna Acharya is MD, DM, MRCP in endocrinology. He is the consultant endocrinologist at K.S. Hegde Medical Academy in Mangalore. He has 40 national and international publications to his credit. I welcome you, sir. So the next panelist is Dr. Sri Devi. So she'll be, due to some technical errors, she'll be joining a little bit later. So the next panelist which I would be introducing is Dr. C.V. Rakesh, Chintla Venkata Rakesh. He is the consultant endocrinologist practicing at Vijayawada, Andhra Pradesh, Sanjeevani Hospitals. He is an assistant professor at Nimra Medical College, Ibrahimpatnam. So he is affiliated with the Endocrine Society of India, ISPA, Endocrine Society, and he has many awards and many publications to his credit. A warm welcome to you, Dr. Rakesh.
Thank you. Thanks, Vishnu, for the introduction. Hi, good evening, all.
Good evening. So the next panelist is Dr. Pragya Gupta. She is DM endocrinologist from the Christian Medical College, Vellore, CMC Vellore. She has many awards, like the first in oral presentation, ESSACon 2020, and many other prizes to her credit. She is also the assistant professor of endocrinology at CMC Vellore. Warm welcome to you, Dr. Pragya.
Thank you.
So, as we all know, we are here to bust some myths about diabetes. And before that, I'll introduce Dr. Sridevi also. She is also joining us in our panel. Welcome, Sridevi ma'am. She is consultant endocrinologist at Apollo Hospitals, Hyderabad. She is the honorary clinical tutor at Apollo Hospitals Education and Research Foundation. She has many awards and honors to her credit, many publications and many poster presentations in endocrinology. Welcome, Warm welcome to you, Dr. Sridevi, ma'am.
Thank you.
So I think I'll start with the busting the myths. First question or first myth which we all encounter is whether eating sweets will cause diabetes. So that is a common question which or common doubt which many people have, and many of them who come to our clinics or OPDs also tell us that I have been eating too many sweets and that's why I have got diabetes. So how much truth is there in that? Is that a myth altogether, or how much truth is there in that? This question is to Dr. Sri Krishna B. Acharya, sir.
Yes.
Please, sir.
Yeah. Once actually I was not able to hear. Can you repeat the question?
Yes, sir. This question is regarding eating sweets, whether it can cause diabetes.
Yeah. This is commonly everybody thinks that eating sugar will cause diabetes. Whether it is true or false, so it's equally important. So eating normal amount of sugar will not cause diabetes. So eating more sugar may precipitate getting diabetes. So what is a normal amount of sugar? So a person with a normal weight can consume around 30 grams of sugar, that is a plain sugar, or a female of around 20 to 25 grams of sugar, or if you take in terms of calorie, so not more than 10% of the calorie should come from the sugar. So if the person is taking less than this amount of sugar, sugar will not cause diabetes. But problem is people tend to eat more and more sugar. For example, if you take a one can of any not juice, any drink like a thumbs up Coca-Cola, it contains almost 50 grams of sugar. So if a person consumes around 1 to 2 per day, so it has seen that patients who are consuming these cola drinks have 25% more chance of getting diabetes. So this is the amount of sugar which important than the plain consume of sugar. Normal sugar, if you take in tea and coffee, will not cause diabetes. It is the excessive amount of sugar if you take more than 30 gram per day as a sugar. It doesn't include the fruits, vegetables, or any other food you take. That sugar is excluded. Plain sugar, if you take more than 30 grams, then the chance of getting diabetes is more. It is not that it will cause diabetes, but there are multiple reasons for the diabetes. So they may be genetically, they may be prone, overweight may be there. So there are multiple factors because diabetes is a multifactorial disease. So this is the one which will precipitate them for getting diabetes. So what it causes? So it has got both direct and indirect effect. So directly it causes inflammation in the liver and also in the pancreas, so that the insulin resistance increases. This is due to direct effect of both fructose and sucrose and glucose. Indirectly, any patient who consumes more and more juices and more sugar tend to become obese. So over a period of time he becomes obese and his insulin resistance increases. This is indirect effect of consuming more sugar. Thus, if anybody who consumes more sugar can develop diabetes, but just telling that patient eating sugar will develop diabetes is a myth. So if you take normal amount of sugar, you won't get diabetes. But if you take more and more sugars, as we nowadays people are taking, that is why we are seeing more and more number of people developing diabetes.
Thank you, sir. So ये इसका मतलब ये हुआ कि we can take sweets. Sweets is not a enemy to
contraindication,
us, but
yeah,
in a moderation, yes. But
in a moderation,
that's
yeah,
in
once
moderation.
in a while, yeah,
That is
you can take.
Once in a while, yes, sir. तो इसका मतलब ये हुआ कि हम थोड़ा सा हम स्वीट्स खा सकते हैं, लेकिन हमारे जीन्स का भी ध्यान रखना पड़ेगा, हमारे मोटापे का भी ध्यान रखना पड़ेगा. We should not become too obese after eating sweets. All these are risk factors in causing diabetes. So thank you for that. Next question is to Dr. Sridevi. Ma'am, some patient might tell us that my sugars have been on the higher side for many years, but it's okay because I don't have any symptoms. So is that true, that if we don't have symptoms, we don't have to worry about that?
Yeah, it's a common occurrence, isn't it? In our clinic, when we see the patients, they do come with high blood glucose levels, and then they say, "No, I don't feel anything. I don't have any symptoms." So they assume that nothing is wrong with them just by looking at the blood glucose levels. They do not want to take any medication, but it is not so. Diabetes is, for a major extent, silent disease which causes damage to various organs inside the body without the patients having any awareness of the damage that it is causing. So many patients present to the OPD with some form of a complication or other, and then they are diagnosed as having diabetes. So you can understand that this particular patient has had asymptomatic diabetes for quite some time, maybe a few years, and then he has landed in a complication. So it is extremely important that the patient who is not having symptoms also, he has to take treatment and get his blood glucose levels under control. Initially, if you see historically, uh, there was a time when high blood glucose levels, if the patient had high blood glucose levels, it was left alone and it was sort of okay. If the blood glucose levels were more than 250, they were given treatment, and less than that, they were still under conservative management. But various studies have shown that, especially the UKPDS study, which we quote in endocrinology circles or in the diabetology circles, which the patients might not know, but that was one of the pioneering studies which has shown us that high blood glucose levels lead to various complications, which are both macrovascular, which includes the heart-related issues or the brain-related issues, and the microvascular, which is the eye disease or the kidney disease or the nerve disease. All of these were found out related to the level of control of diabetes of the patient. So, extremely important to emphasize to such patients who say that, no, I do not feel anything, I do not have any problem, that blood glucose levels need to be maintained under good control in order to avoid complications, and uh, educate them as to why diabetes causes damage to the various organs, multiple organs, which it involves in the long run.
Okay. So the essence of that was Dr. Sridevi ma'am told us that the major part of diabetes is asymptomatic. There will be no symptoms. कोई भी symptoms नहीं होगा, में कोई problem नहीं होगा, परेशानी नहीं होगी. Still, sometimes you will have diabetes, and if you have diabetes for a long duration, you are at a high risk to develop complications. To avoid the complications is what we are trying to treat, and not for symptoms. So that is what Sridevi ma'am told us. Now, the third question is a little controversial one, and we'll start off with that controversial question to Dr. Rakesh. Dr. Rakesh, is there any truth in the assertion that alternative therapies can cure diabetes?
Good question, Vishnu. And why? Because today, in present generation, we see many people many patients saying that they were diagnosed with diabetes few years back, say 2 years or 3 years or 5 years, and they were not using the proper medications and written by or prescribed by the physicians or the endocrinologist. The reason being, they have been using forms of therapies, alternative therapies like supplements, nutritional supplements, or fruits, or homeopathy, or Ayurveda. And they say that my HbA1c, my sugars have come down to normal after using these medicines, and I don't need to use any other medicines. See, diabetes is a lifestyle disorder. If you know the pathogenesis of diabetes, then we can comment on whether these alternative therapies can cure diabetes or not. So basically, diabetes occurs because there is a defect in the pancreas, either due to insulin secretion or at the tissues level, it's the insulin action. So only the treatments which alter this pathophysiological process only can remit diabetes or can control diabetes, but not the other therapies. So there might be mild glucose reduction or mild HbA1c reduction. For example, if the 3 months average, what the patient say in our normal language, if it is say 6.4 or 6.3, because of this alternative therapies, it might come down. But it doesn't mean that we should continue only with alternate therapies and the patient need not require any other monitoring. The patient has to be monitored, and the patient has to be regularly monitored and see for the fluctuations in the sugar levels. And then at appropriate treatment, at appropriate time, we need the patient to start on medication so that we prevent the complications. As previously, Sudhir Madam and you discussed, complications, again, they are present at the initial stage itself, but they are asymptomatic. So we need to start treatment at the earliest. And regarding these alternative therapies, and we also have seen whenever they're reducing the sugar levels, it's not only due to that molecule per se. There is some amount of other compounds which are added, like sulfonylureas, which we commonly use in the form of drugs. So mild amounts of sulfonylureas are present in those alternative therapies, which can drastically reduce the sugar levels. And at the same time, some of these products can improve the insulin secretion and insulin action to some extent. So you can use alternative therapies unless they are not harmful and they do not contain any other compounds which affects the body, and that has to be taken under the advice of the consulting doctor, the endocrinologist, and then only you have to use it. And with that conception that I'm using alternative therapies, I don't need to use any other medications, I don't need to follow up with the doctor, is completely a myth. And you have to definitely follow up, and you have to I have to tell the physician or the endocrinologist what medicines you are using, so that they understand why, because some of these medicines might lead to wastage, some of these medicines might lead to other complications too. So all that has to be taken into consideration, and then after approved by the physician or the endocrinologist, then only you have to use that medicines in moderate amounts.
Okay. Dr. Rakesh, most importantly, you were speaking about diabetes. Maybe you are talking about type 2 diabetes. But nowadays, people
Type 1
have been
diabetes, yes.
even they are going to the alternative practitioner saying type 1 diabetes, there is no other treatment other than insulin. And
Yes.
it's a life or death situation. Even in that situation, people are going to alternative medicine. And most
In type 1
importantly,
diabetes, type 1 diabetes,
that's
again, this is one good question raised, because previously there was a lot of circulation in the media that type 1 diabetes patient need not use insulin. There is one more, don't want to go into the topic and who prescribed it, but you use our medicine, you need not use insulin for type 1 diabetes. That has gone so rampant that type 1 diabetes children come to the clinic and asking that should I stop insulin? No. For example, type 1 diabetes, which is a very good point. Type 1 diabetes, insulin is the only option. There is no alternative treatment. There is no any other alternative treatment. You have to use insulin. When you use alternative therapy, it might slightly modify the insulin dosage, but apart from insulin, there's no other option. You have to use insulin in the prescribed format, in the prescribed regimen. So don't be foolish in using, completely stopping that insulin and going with alternative therapy and then landing up with the complications and ketoacidosis in hospital.
Yeah, thank you, Dr. Rakesh. So the other major important myth which people have is that I am normal weight and still can I have diabetes? So should we be overweight to have diabetes? Dr. Pragya is our next panelist. Could you enlighten us about that? Do you have to be overweight to have diabetes?
Whenever we think of, am I audible? Yeah. So that's a very good question, because whenever we think of diabetes, we think of obesity as the major risk factor. It is the major risk factor for, especially for type 2 diabetes. But whenever we categorize a person as overweight or obesity, is based on a tool which is called body mass index, which usually which considers weight and height, and according to that tool, we classify a patient as overweight or obesity. But we have to understand what this BMI tool doesn't take into account is the percentage of this weight which is contributed by fat, the percentage which is contributed by muscle, and especially the fat deposition in the body. So ये fat कहाँ पे deposit है? It's a very, very major risk factor for type 2 diabetes. So what is said, if this fat is accumulated in the abdomen area, around the organs, what we usually call belly fat, tummy fat, or visceral adiposity, that is a major risk factor. So even if a patient is having normal BMI and is having more waist circumference, factor for diabetes. Then other than weight, we have many other risk factors, like we have ethnicity, family history is a very important risk factor. We have age, then if there is a history of diabetes in pregnancy, and as well as there is risk associated with what diet we are consuming and what lifestyle we are living. So, but if we see all these factors, of course, weight is one of the most important modifiable risk factor as far as type 2 diabetes is concerned. And as Asians, we all are at very high risk of diabetes. हम में से किसी को भी diabetes हो सकता है. And the only factor which we can modify is our weight, diet, and exercise. So leave aside whatever our weight is, we should aim for healthy lifestyles, including healthy food, healthy physical activities, and should always maintain our weight under check. And just wanted to mention one more thing. We as an Asian, we have a lower cutoff when it comes to BMI and waist circumference as compared to the Western. So एक चीज जो पता होनी चाहिए कि हम में से किसी को भी डायबिटीज हो सकता है और सबको डाइट और एक्सरसाइज होना ही होना है, and it should start early because nobody is spared, nobody is immune to diabetes. Everyone is at risk of diabetes in future. Yeah.
Hello, Vishnu, you are not.
Sorry.
Audible.
Sorry. I was mute. Okay. So that was a very important point, Dr. Pragya, that Indians or Asians, we being Indians, we don't have, or rather we have the high chance of developing diabetes. So anybody of us, even people who are sitting in this panel, could have, or if we don't have it now, we might get diabetes in the near future or probably in few coming years. So that is a highest risk group which we are all together, and we don't have to be obese. It's in our genetic predisposition to develop diabetes. A little bit of fat in our tummy or a little bit of fat in our liver or in our pancreas can tip the balance to the bad side, and we can develop diabetes. So that is a myth regarding type 2 diabetes. And here also I would like to emphasize that there are many other types of diabetes where the person itself is lean. And pancreatic diabetes, for example, in our part of the country, we have many cases of pancreatic diabetes which the patient might be lean and they have very high blood glucose, and they are likely to develop complications very early. So thank you for that. Our next question is to Dr. Sri Krishna. Somebody is telling me in my OPD that I don't have to watch myself that much because I have only a touch of sugar. My diabetes is only borderline. So is there something like a borderline diabetes, or is every diabetes bad?
This is commonly there. Most of the people, and most likely most of some of the doctors also tell you are having a mild diabetes. So this is the most common thing done by some of the general practitioners also. So these people will take catch of that, and then they'll everywhere they go, I have mild diabetes, I need not take treatment, I need not visit doctors. This is very common. So there is nothing like mild diabetes. So diabetes is there, means diabetes. So irrespective of what is the level, you need to be on diet and exercise. So even not about diabetes, even pre-diabetes. So patients with the pre-diabetes, we know that each patient with the pre-diabetes, the chances of all the micro and macrovascular complications are more. So as per the studies, we know that by the time patient diagnosed as diabetes, almost 50% of the beta cells are lost, and almost 5 to 10 years of hyperglycemia is there. So already all the complications have already started. So this is the time you have to prevent. So if you are thinking that it is a mild diabetes and I don't want treatment, I will take treatment once it becomes more than 200, 250, you will lose that golden opportunity to prevent that complications and revert it back to normal. So we know that most of the patient in pre-diabetes also, almost 10 to 25% of the patients will have neuropathy if you diagnose. And almost various studies have shown that nephropathy means microalbumin are seen in 13 to 25 to 27% in a pre-diabetes or newly diabetes patients. And also retinopathy, 7% of the patients with pre-diabetes have retinopathy. So, and also cardiac autonomic neuropathy is seen in almost 8% of the patients who got detected with diabetes. So all the complications are already started patient who, when he was diagnosed to have diabetes. So if you are telling that mild diabetes, my diabetes is mild, I don't require treatment. So this is a time where you have to take the treatment and you have to bring it back to normal. You have to reverse that all the complications. This is the ideal time to stay. So most of the times, and also you have to see the age of the patients. So maybe if a patient is a 70-year-old, okay, he is pre-diabetes, there may not be any need to treatment. But here we are now seeing a patient with 25, 30 coming with a pre-diabetes, and we have to think about their next 30 to 40, 50 years. So if you don't start the treatment in the pre-diabetes stage only, most likely they will land up with the all the micro and macrovascular complication maybe 10 year or 15 year later. So there is nothing like mild diabetes. Any patients who's diagnosed to have diabetes, also who is having pre-diabetes or impaired fasting glucose or impaired glucose tolerance, they need to be on treatment unless they are able to reduce their sugar to normal level with a strict diet and exercise, which is possible only in a 10 to 20% of the patient. Rest 80% patients, they think that they don't have any symptoms and they will go with their blood sugar of 130, 140 and up to 200. So they think that they are asymptomatic and then rarely go to the doctor. But all these patients should go to the doctor and take treatment. This is the golden opportunity for them, so that they can, because we know that all the complications like maybe nephropathy, it's a diabetes kidney disease is the most common cause of requiring dialysis or renal transplantation. So if you want to prevent all these complications, you should start treatment as early as possible. Better to start at the pre-diabetes stage in a young patient rather than allowing him to go to the diabetic stage and then he can develop complications.
Yes. So, Dr. Acharya sir mentioned that even practitioners, doctors are guilty of this thing, that we are saying to our patients that this is only my diabetes. You don't have to take, you can try diet, you can try. So golden opportunity or initial diagnosis, you can say that the initial 1 year or probably 5 years of diagnosis of diabetes, that is a golden time where if you don't have a good control, then there is a high chance that you will develop complications later on in your life. So we are trying to prevent those complications by treating patients who have early diabetes, or whenever they are diagnosed with diabetes. At least when they are diagnosed with diabetes, they should be aggressively treated, hit hard and hit early. So that is what our message is to even doctors and other practitioners. So next question is Dr. Sridevi. Can you please enlighten us about the seriousness of type 2 diabetes?
So the question is type 2 diabetes less serious than type 1 diabetes? So here it is very important that we differentiate both the types of diabetes. What is type 1 diabetes? Type 1 diabetes is due to an autoimmune process in which the body's immune system is targeting its own tissues. Like in this case, it is targeting the pancreatic tissue, because of which progressively there is attack on the beta cells of the pancreas, which are the major insulin producing cells of the pancreas. The major factory which produces insulin is the beta cells of the pancreas, and it is being attacked by the person's own immune system. Now, why it happens? It could be due to certain genetics. It could be due to certain viral infections. It could be due to certain environmental toxins. So, whatever the reason, the beta cells are under attack and they lose the capacity to produce insulin. And almost there is zero insulin production in type 1 diabetes. Naturally, in such patients, the treatment of choice would be giving insulin externally. Now, in type 2 diabetes, there is decrease in the efficiency with which the insulin works, whether it is due to insulin resistance or certain dysfunction in the beta cells. It differs in patient to patient, as it was mentioned that there are different types of type 2 diabetes also. So type 2 diabetes, in which there is no autoimmune process, but there is a difficulty in the insulin being used efficiently by the body's tissue, such as fat tissue or the muscle tissue, which is what we call as insulin resistance. It is not a extremely serious disorder, but it is an important disorder because 90% of the population who are having diabetes have type 2 diabetes. Type 2 diabetes is much more prevalent than type 1 diabetes. And type 2 diabetes, because of its increased prevalence all over the world, affects the health systems more than the type 1 diabetes. So type 1 diabetes, if it is around 8% in the general population, type 2 diabetes will be around 90% if you look at only the diabetic patients. So even though I would still say that type 1 diabetes is certainly serious disease, and we have to be much more equipped to deal with these patients, to deal with their problems, because it is usually the children who are affected. Type 2 diabetes, because of its sheer volume all over the world, and because neglecting type 2 diabetes leads to various complications, whether it is kidney disease or heart disease. And most of the admissions or the mortality in type 2 diabetic is due to heart related issues or stroke, which are the major causes of mortality anyway. So type 2 diabetes is definitely serious disorder because of its sheer volume, and also because it can lead to various chronic illnesses like chronic kidney disease, which puts the patient at an increased risk of mortality in the end, or having a heart attack or having a stroke. All of these complications are much more commonly seen because type 2 diabetes is much more prevalent. So certainly type 1 diabetes and type 2 diabetes both are to be taken seriously, and both have to be dealt with accordingly.
Yes. So people always have a feeling that type 2 diabetes is because I have type 2. Just because it is named type 2 doesn't mean that it is in second in importance. Both are equally important. Type 1 diabetes has got its own problems, and type 2 diabetes is also a serious condition. And people should not take it lightly, as Dr. Sridevi has highlighted. So we'll go to the next myth. I have just been diagnosed. This is an extension of what we were discussing before. I have just been diagnosed with diabetes. I can't have any complications. Is that true, Dr. Rakesh?
Yes, again, this is the common question which is asked in our OPDs. As previously Dr. Sridevi and Dr. Vishnu have discussed, most of the times the diabetes patients, when they land up, they already have complications. So these complications get diagnosed only when they screen them. So if they are not screened, usually since they are asymptomatic, they don't get diagnosed, and you have to screen them. So in screening, like complications like either for cardiovascular risk, for cardiovascular risk, or for nephropathy risk, or for the retina risk, if we see, and for the neuropathy risk, as if you get screened of these patients, majority of them will be having one or the other complications. As previously, even Sri Krishna Acharya had told that neuropathy is present in almost all 25% of the patient, and retinopathy is to the tune of 20% of the patients, and nephropathy is also seen to the tune of 20% of the patients. So either it might not be a severe complication which hampers the quality of life, but these complications are mild, so that in the long run they can lead to cardiovascular risk, and it leads to mortality, because this is the most important risk factor for diabetes. So type 2 diabetes at diagnosis itself, they are at risk and they have to be screened for complications. It doesn't, since the symptoms are not there, it doesn't mean that they don't have any complications. In type 1 diabetes, they have some, since it is diagnosed earlier, much earlier than type 2 diabetes, they don't have a much asymptomatic phase or pre-symptomatic phase as in type 2 diabetes. They might land up with complications a bit later, but complication screening should start as per the age and as per the guidelines. So I don't have complications, I don't have symptoms. The symptoms are appear much later and at the severe stage of complications where we can't do anything. So we can't do anything much. So we have to diagnose at the earlier stage so that we prevent that patient landing into that longer complications or severe complication stage. And we have to use that golden opportunity. So we have to take out that apprehension or idea that I don't have symptoms and I don't have any complications, because complications most of the times are asymptomatic and they have to be screened.
Yeah, screening. So screening is the most important, as Dr. Rakesh mentioned. When we tell our patients, देखो आपको आंखों की जांच कराना चाहिए, आपको डायबिटीज है, आप आंखों के टेस्ट करा लो, आपको 5 साल से डायबिटीज है, या तो sometimes even people who have 10 years of diabetes, 20 साल से डायबिटीज है, still those people would not have checked their eyes. And when we ask them, they say, मेरे आंखें तो ठीक है, मुझे तो दिखाई देता है, मैं अच्छे से पढ़ाई न्यूज़पेपर पढ़ सकता हूँ, तो why should I check my eyes? So we should tell them that these are all asymptomatic complications, and even doctors, many of them don't do eye checkups or frequent eye checkups for patients. Patients should become aware themselves and get checked up for the complications. Next is a very important question, and Dr. Pragya would be the right person to answer this question. Because in CMC Vellore, there are many studies about young onset type 2 diabetes. So this myth about whether children or young people don't get type 2 diabetes and adult patients don't get type 1 diabetes, is that right? Is that a myth? Dr. Pragya?
Yeah. So before we move on to this question, we have to understand what is the basic difference between type 1 and type 2 diabetes. And as Dr. Sridhar has already mentioned, uh, type 1 diabetes is a form of diabetes, as Dr. Sridhar has mentioned, that there is a damage to the insulin producing cells of the body, which leads to insulin deficient state. And this is mostly seen early in the life. Usually, majority of the patients who present with diabetes under 20 are diagnosed with type 1. That is the classical teaching, which we have also read in our medical books. Whereas type 2 diabetes is basically because of contribution of the insulin producing cell dysfunction is there, and also there is something called, which is called as insulin resistance, in which the insulin which is there in the body is not able to function because of various reasons. So what is classically said is that prevalence of type 2 diabetes increases with age. That is true also, but what I would like to emphasize is that there is no clear-cut barricade as it comes to the age of presentation between two. So approximately 30 to 35% of patients, up to 40% of patients who are diagnosed with type 1 diabetes are diagnosed after 30 years of age. So type 1 diabetes can present at any age, and so is true for type 2 diabetes also. So with the current pandemic of obesity, in which we are seeing increasingly, surprisingly, alarmingly increased rate of obesity in first decade, second decade, we are seeing teenagers adolescents coming with diabetes and diagnosed with type 2 diabetes. And somehow that age gap is not no more there. So just on the basis of age of presentation, we can't tell it's type 1 and type 2 diabetes, and we need further laboratory testing as well as imaging if necessary, and this call has to be taken by the physician. Now, why it is important? Because as previously discussed, the management is entirely different, at least in the initial phase of the illness. So for type 1, basically insulin has to be promptly started, whereas for type 2, we basically emphasize on the lifestyle modification as well as oral anti-diabetic agents if needed. And just on the basis of age of presentation, we can't decide whether this patient is type 1 or type 2. And so basically, if we are a patient of any age first diagnosed with diabetes, don't start treating yourself thinking it's a child or if it's an adult. We have to visit physician, let the physician decide what kind of diabetes it is, and then the treatment has to be started once the diagnosis is made. So yeah, just based on the age of onset, we can't decide that it's type 1 or type 2 diabetes.
Thank you, Dr. Pragya. So what she was saying is that even children can get type 2 diabetes. So we are finding so many obese children nowadays who have black marks on their necks. They are coming with obesity, and along with obesity, they are also having a higher risk of getting type 2 diabetes. So just because the patient or person is young doesn't mean that he or she has type 1 diabetes. They can have type 2 diabetes also. And even adults above the age of 30 years, as Dr. Pragya mentioned, even 1/3 of the patients come after 30 years. So out of 3 type 1 diabetic patients, 1 patient might be more than 30 years. So even at the age of 50, 60 years, we can get type 1 diabetes. That's what Dr. Pragya said. We have some more myths to bust, but we also have got some questions to answer. I think we'll answer those questions before we go to the next round of myths. We have around 15 to 20 minutes left. One question which has come in the Facebook chat is considering fruits. So that was the first question to Dr. Sri Krishna Acharya regarding the eating sweets, whether it can cause diabetes. So this question is related to that. So I'll put that question to him. All the fruits contain fructose? So should diabetic patients avoid taking all fruits? That's the question. Some people was one nutritionist has asked the person that green apples have less fructose and less potassium. So is it only safe to eat? Which is the only safe fruit to eat for diabetic patients?
Actually, all the fruits can be taken, but there are category of fruits based on their glycemic index. So we have to categorize the fruits, and then we have to try to avoid the fruits with the high glycemic index. As such, fruits are good. They are good for health. They have got vitamins, minerals, everything is there. So if you are eating too much of fruits with a high glycemic index, that itself can lead to hyperglycemia. Otherwise, fruit is not a contraindication for any diabetic patients. So you have to categorize which fruit is best, and especially the fruits with the low glycemic index. This you can take in more amount compared to fruits which are high in glycemic index. So fruits should not, because fruits contains fructose, but that doesn't mean that you should not eat. So moderate amount of fruits can be taken, and then based on the glycemic index, we have to categorize which fruits we need to eat more and which less. So there is nothing like this fruit should not be eaten for diabetics. Nothing is like.
Yeah, many of my patients also always say, "Oh, they'll be fondly surprised that I might be the first doctor to tell them that you can eat fruits." Many of the doctors themselves, the practitioners have warned them against eating fruits, and they'll get all sorts of vitamin deficiencies after not taking fruits. Dr. Sridevi, the other question has come up. This is a very big fad and newest fad about intermittent fasting and ketogenic diets. That is the other question here. What is the role of intermittent fasting and ketogenic diet in controlling blood glucose? Is there any role for that?
So I think the next 2-3 questions are on weight loss and how it controls diabetes. There are definitely positive indicators about intermittent fasting leading to definite results with respect to weight loss. Whether a particular diabetic can do that intermittent fasting or not depends on his level of diabetes, his overall blood glucose control, what is the type of medication that he is on, and also what are his comorbidities and all. So we can't put a blanket view and say that intermittent fasting, which has shown to cause good amount of weight loss, why don't every diabetic try it? So that would certainly not be a good message to convey. Uh, Losing weight is certainly desirable in all diabetics. We do have 2-3 questions addressing that, but uh, uh, how he loses weight is also important. So losing weight by doing a fad diet would certainly put him in greater risk, especially with respect to hypoglycemia, and also ketogenic diet, which leads to a lot of derangements in their lipid levels. So a structured low calorie diet which can be prescribed by a proper nutritionist, keeping in view all the comorbidities and the medications that you are on, it can certainly be tried. The weight loss measures can certainly be tried, but it's certainly not a blanket advice to go for intermittent fasting in all the diabetics. We do have 2-3 questions after that addressing the weight loss and all that.
Vishnu, you are muted.
So we might not be able to cover all the questions which we have planned. So this was a very important question, as Dr. Sridevi mentioned. She is always conservative about giving advices, I think. So she has mentioned that we should not give a blanket advice to all patients with diabetes to start intermittent fasting. Though we have to try to reduce our weight, we should not advise all our patients to try intermittent fasting. It should always be done with the consultation of a treating physician and a good nutritionist. So that's our advice to the public. So we go to the next question to Dr. Rakesh. Dr. Rakesh, if I am sick or if I am not able to eat properly, then should I take diabetic medications? Because many of the patients do such a thing. They stop their medications or they stop insulin when they are sick, when they are not able to eat. So should they do that?
Yes. Here, this is again one more myth that patients have, either with type 1 diabetes and type 2 diabetes, both of them. When they are sick, since they are not consuming and they are not eating anything, they have the fear of going into hypoglycemia and they stop all the medications. Coming to type 1 diabetes first. So whether to stop insulin or not. No, insulin shouldn't be stopped at all at any point of time. The dose alteration might be there, but dose alteration in that particular sick period will be according to the glucose readings, where the frequency of glucose reading, checking the glucose is much more than the previous non-6 days. So there are sick day guidelines clearly established, and the sick day guidelines, you have to ask your doctor treating endocrinologist about the sick day guidelines and how to monitor the sugars and how to adjust the insulin dose depending upon that. So you should not skip the insulin dose. You should not completely stop it, because it lands up in complications like decay. And there is severe critical sick condition like sepsis where they land into hypoglycemia, but again they are admitted in the hospital that time and they will be take care of the insulin there in the in-hospital setting. In the outpatient setting, when you are mildly sick, definitely the insulin has to be taken with much more cautious, with much more increased frequency of monitoring. Coming to type 2 diabetes, even in type 2 diabetes, I have skipped the dose for the past 10 days since I am feeling sick. And you see the sugars are going up beyond 250 and 300 and the patient landing to you with asthmatic symptoms. Again, that shouldn't be the case. So whatever the prescription that has been given, the dose that has to be taken. And if they're taking the insulin, depending upon the symptoms and depending upon the glucose readings, the insulin dose has to be adjusted. But the rest of the medication has to be continued and they shouldn't be stopped unless doctors prescribe you to stop due to some reasons.
Yes, so you should visit your treating physician or endocrinologist, especially when you have any sickness or illness,
Yes.
and ask them whether you should continue the medicine or at least you should not stop without asking them. Even if you are not eating, many of the medications will be working and they will be there to control your fasting blood glucose levels or maybe to maintain your metabolic parameters. So you should not stop insulin or medications without asking or consulting your doctor. So that's the message given by Dr. Rakesh. The last question, I think, because we are running short of time, I'll give this question to Dr. Pragya. And this is a very important question regarding diabetes medications once again. Many patients tell me that taking diabetic medications will increase their weight. Is that true? Taking diabetes medication, will that cause gain in weight?
So, so the question is whether the medicines which are prescribed for diabetes causes weight gain. Again, this is partly true, but not true also. So there are multiple oral anti-diabetic agents which are prescribed for diabetes, and including insulin also. So some of which can cause indirectly they can cause weight gain. Some doesn't have any effect on weight, what you call it weight neutral, and some of these medications can cause weight loss also. Now coming to insulin and the medications which are associated with weight gain while the patient is on these medications are sulfonylureas like glimepiride, glibenclamide, and a group of medicines which is called as pioglitazone. Now, coming to insulin, why when a patient is on insulin tends to gain weight? The reason is when insulin is an anabolic hormone. So whenever a patient on insulin is consuming more calories, those extra calories is converted to fat by insulin and that gets stored in the body in the form of fat. So it's not actually the insulin which is causing weight gain, rather the mismatch in the calorie intake and the consumption. So what we have seen when patient is on insulin, we have seen two major things which patients often do. One thing, they usually consume more calories than required because they are very worried about the risk of hypoglycemia. So just to avoid the risk of hypoglycemia, although they are not having hypoglycemia, they tend to eat more so that they don't have hypoglycemia. The second thing what we have seen is when patient is on insulin, patient knows that if they're taking more, they can just increase the dose of insulin and that will bring blood glucose under control. So what patient does, patient very frequently starts taking high calorie diet and just to compensate that hyperglycemia, patient will increase the insulin dose. So these are the most common causes of what happens when the patient is taking excess calories while on insulin. The excess calories are getting converted to fat and getting accumulated in the body in the form of fat. So it's not basically the insulin which is causing weight gain, but rather the excess calorie which a patient is taking while on insulin. Same is the thing with sulfonylureas also because they causes increased insulin secretion from the pancreas. They also work on the same line. So whenever you are on all these medications and you think you are having weight gain while on the medications and you think that medication is causing the weight gain, please consult a physician because most often than not, it is the calorie intake and the sedentary lifestyle which is at fault. So your physician will assess whether that's the problem. If that is not the problem and you're maintaining your diet and doing your physical activity and still putting on weight while on these medications, then we have other options also which we can shift if weight gain is a major problem. So yeah, so basically these medications per se doesn't cause much of weight gain. It's rather the otherwise the food and the activities which we are doing while on these medications causes weight gain.
Yes. So Dr. Pragya mentions that there are many medications nowadays in our hand. Doctors now have many options, not the older medications like glimepiride or glibenclamide, which were causing weight gain. And if that is a problem to you, then you should consult a physician or endocrinologist and try to change the medication to newer ones, which doesn't cause a weight gain, can even help you to reduce your weight. So that's the message which Dr. Pragya wanted to highlight. Thank you for that. So I think we have just completed our 1 hour of Facebook Live. I'll ask Dr. Srikrishna sir, Dr. Srikrishna Acharya, could you please summarize or give a final message to the audience who are listening to our FB Live?
Yeah, so there are many myths and facts. So you should not go by the whatever the other person or the WhatsApp. Now is the WhatsApp University is the most common. So you get so many forwards. So you should not go. So you can go to the internet and you can see there are usually credible information is there. If you go to a good site, so where you can get, or best is to ask your doctor regarding what is correct and what is wrong. So unless rather than believing whatever is forwarded in the WhatsApp, you just go when you are go to the doctor, ask which is the things you need to do, which are the tablets, which is best, is what are the side effects of the drugs. Everything you need to discuss with your doctor so that you can get a very credible information regarding diabetes rather than asking your friend or somebody who has got diabetes or some other person. Best is to your doctor, or if you find it difficult, you can go to the website where you get a real information regarding the diabetes and you can get knowledge regarding the diabetes, and don't fall to the WhatsApp which tells most of the things which is forwarded are either not followed or which is detrimental to your health. So my sincere request to all the listeners to discuss with your doctor whatever problems you are having. So discuss whatever it may be right or wrong. You can easily, it is not a difficult thing, you can easily discuss with your doctor and doctor will answer all your questions without any hesitation.
That was a good message, and rightly said that WhatsApp or social media is not the place where you go for information or proper information. It is your trained physician, trained modern medicine practitioner or endocrinologist whom you should consult if you have any doubts about diabetes. So thank you. Thanks to Dr. Srikrishna Acharya sir, Dr. Sridevi, Dr. Venkatarakesh, and Dr. Pragya for spending the time with us and enlightening us on the diabetes myths and facts. So this is the end of the final session of diabetes program, and next month we would have a pediatric endocrinology programs happening every Saturday evening in Facebook Live from 4:30 to 5:30 p.m. So thank you all. Thank you, the listeners. Good evening to all.
Thank you.